Hi everybody, Dr. James Pietrek, upper cervical chiropractor in Rancho Bernardo. Today I want to talk to you about better oxygen flow, oxygenation throughout our entire body and how it relates specifically to helping with fibromyalgia pain. Now, fibromyalgia, of course, when we think of that, we think of the tender points spread throughout the body. And most of the tender points are located in the neck and the shoulders area. And what the research shows is that these areas of tenderness are associated with lactic acid buildup. And of course, lactic acid buildup is due to the body's inability to flush away the acids because of lack of proper blood flow and oxygenation to the tissues. So I want to talk to you today about 3 things to help you breathe better. You got to breathe anyways. 3 things that you can do right now. We're looking for small improvements, at least to the point that you can notice a difference in as little as 3 days, so that you'll want to keep on doing this and get better and better and better at it. So the first thing that we have to talk about is how we're taking air in. Let's start right up here at the top, literally up at the top. And you'll notice here that the hole on the top, the pharynx, where your nose is, it's actually bigger than your larynx. And so it's a more efficient air supply to take air in through our nose. So the place that your tongue should be, in order for air not to come up here and kind of get trapped in here, so it can flow straight down into the trachea, into the lungs, is to have your tongue straight up at the top of your mouth. Breathing through your mouth has a few benefits, namely it filters the air, keeps the pathogens out, unlike our mouth can. It humidifies the air, it conditions the air, it cooks it up to proper temperature. If you breathe in through your mouth, you don't have sensory linings, temperature sensors in your trachea and your lungs. You just breathe in through your mouth. And if you have room temperature air in your lungs, your body has to adapt. You're not going to feel cold or even have chest pain necessarily, but it's just one extra thing that your body has to adapt to. So you want to be more in sync with what your body wants, and that is you breathing better through your nose. Now you might be thinking that I'm congested all the time out of one nostril, one side, my sinus, I guys have the sinusitis thing. If that's the case, you might look at your diet, because you could be having an inflammatory response, and so taking out certain foods could help you benefit. You also might want to try a sinus rinse, a neti pot or some kind of a saline solution to make sure that you're nice and clear. Now, the other thing we have to talk about is, where are we directing our air to? Well, let's talk a little bit about anatomy. The alveoli are the oxygen receptor sites, and most of them are located in the bottom 1/3 of your lungs. So in order to direct the air down there, we should be using our diaphragm muscle more. The diaphragm is right underneath the lungs, and it goes up when we breathe out, and it goes down when we breathe in. So I want you to get better at using your diaphragm muscle, belly breathing basically. So use your chest less, use your belly more, not just while you're doing your everyday thing, but even when you're talking to people. If you can control yourself so that you only speak while your belly is going in, and then you take another breath, not only will it help you to preserve energy throughout the day, like a Spartan, it'll also help to save your voice. You'll be less raspy, especially if you have to do a lot of talking during the day. So again, only speaking while your belly is going in, all right? So speaking of Spartans, did you know thousands of years ago, Spartans in training, they would take in water maybe up to about right here, and they were to go and run several miles. And they couldn't spit out the water until they were done. They weren't allowed to swallow it. And the reason is they needed to learn how to build up their energy reserves like an accordion, going in from the top all the way down here into the belly, because that is what, they didn't know this at the time, but it was very genius of them. They were building up their energy reserves. They were utilizing their hemoglobin. They were utilizing carbon dioxide better, because it's the carbon dioxide that loosens the bonds between hemoglobin and oxygen, so it can correctly and efficiently get out to the different tissues, not just in the in the body and in the spine and the tender areas of fibromyalgia, but even to the brain. Your brain consumes about 20% of your oxygen supply. And if your brain's not working right, that's where you can get the brain fog and some of these other issues, even sleeping problems. So we want to breathe through our nose, we want to belly breathe. The other thing is, most of us, we're breathing too fast. The experts say that we need to breathe slower and take longer breaths. I was shocked to see this, but I understand now how if you really control it, you can do this. If you're 5 feet tall, you should be breathing in and out about 6 times per minute. If you're taller, then it would be 3.5 breaths per minute. So when you breathe in, pretend you're 5 feet tall. You breathe in for about 4 seconds, ideally through your nose and with your belly, and you'd let it out through your nose as well, but you breathe in for 4 seconds, hold for a second, and breathe out slightly longer than you breathed in for 5 seconds. And that would equal 6 breaths per minute. You can do the math all the way out to, if you're 6 feet tall, that would be 3.5 breaths per minute. So there you have it. We want to breathe through our nose better, we want to belly breathe, we want to breathe slower. This is to maximize, to optimize proper oxygen flow throughout your body so that your body can heal up, so that your body can flush away the lactic acid buildups. In my office, I really do one thing and one thing only. I correct the misalignment at the top of the spine, because when this is off, you can't walk around like this. So what nature says is, let's go ahead and we're going to walk and we're going to compress like this to preserve or to compensate from what is usually a head, neck area type of injury, which caused many of the fibromyalgia problems in the first place. So we'd like to help you. We're located in Rancho Bernardo, right at the intersection of Rancho Bernardo Road and Bernardo Center Drive. Give us a call, shoot us a message if you have any questions whatsoever. Thanks for watching.